Hello, everyone. I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom at Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host this show about pediatric health topics where we take and answer your questions live. Because of the COVID-19 and the safety measures we must all take to be safe, we are coming to you live today via Zoom to help maintain social distancing. Today, we will be discussing several things related to how to keep your family safe and healthy during the COVID-19 pandemic, including addressing questions that you might have about children returning to school this fall. Joining us for this discussion is Dr. Rajapakse, a pediatric infectious disease physician at Mayo Clinic Children's Center. Thank you to all the people who have already sent in questions. We have read them and we have tried to summarize them in the topics that we will discuss today. We cannot offer specific medical advice for your individual's family circumstances, but our goal today is to try to provide you the accurate information and framework to help make the best decisions for your family. So Dr. Rajapakse, thank you so much for joining us today.
Thanks for having me back.
Yeah, so when you joined us at the beginning of March, we were just starting to get information about COVID. And today we're going to bring everyone up to speed about what's known regarding the latest research about COVID and the SARS-CoV-2 infection. So let's start by really understanding the terminology. So we hear COVID-19 being thrown around and we hear SARS-CoV-2 infection. Can you help us clarify what's the difference between these two?
So COVID-19 refers to the disease itself, so coronavirus disease 2019. SARS-CoV-2 is the kind of short form we use for SARS coronavirus 2, which is the virus that causes COVID-19 disease. Because you can have asymptomatic infection with SARS-CoV-2 virus, not necessarily everyone who is infected with the virus has disease itself.
Mm-hmm.
That's why the difference in terminology is important.
Absolutely. So what are we seeing with the recent trend currently with the SARS-CoV-2 infection across the United States? There was a lot of talk about the curve flattening, but are we starting to see a second emergence or a second wave of cases coming?
So unfortunately, we're in quite a concerning phase of this pandemic where while we did see some initial decrease in cases through the spring and early part of the summer, now many areas of the country are seeing rising rates of cases again. This has been especially prominent in the southern part of the United States, so Texas, Florida, Arizona, California. And what we're seeing is that as places reopened, we're seeing a lot more people out and about, and this is resulting in more cases occurring. There's been an increase in cases amongst the younger population who seem to be the ones who are spending more time out in public, but definitely we're also seeing cases kind of across all age groups increase in those areas.
So since March, a lot has changed about what we know about transmission of COVID specifically and what we know about how it infects kids. What does the infection look like and the symptoms that children will see?
So what we're seeing in children is definitely children of all age groups can be infected with this virus. When they do become infected, they tend to be more likely to be either asymptomatically infected, so they don't have any symptoms, or to have mild illness. However, there are children who have had severe illness. There have been children who have died from this infection as well in the country. And so it's important to realize that while overall the evidence is kind of reassuring that most children do well, we do have these cases that have been more serious, and that's why we really need to think carefully when we're talking about things like reopening schools.
Mm-hmm. And that gets to the idea about transmission and about how SARS-CoV-2 is transmitted. And are children able to transmit if they are asymptomatic to adults?
So asymptomatic infection and transmission is something that we've really learned more about as this pandemic has progressed. I think when we look at other viral infections like influenza or RSV that we have a lot of familiarity with, asymptomatic transmission of those really is not a prominent way that pandemics or epidemics get propagated. This virus acts very differently. So some studies have described that up to 30 to 40% of people in some studies that they've done have been asymptomatically infected. And when you have such a large group of people that are asymptomatically infected, they can play a much larger role in transmission of the virus. And that's where the recommendations about masking in public comes from. One of the reasons why that has been an effective strategy to reduce the transmission of cases in multiple areas. So yes, definitely we know people of all ages can be asymptomatically infected. We do know that they can transmit the infection, and we know that everyone wearing a mask in public is one of the best ways to decrease the risk of that happening.
Do we know if children are any different in their ability to transmit the virus if they are asymptomatic, or is that information that we're still kind of waiting to get more knowledge about?
So in the last couple of weeks, we've gotten some useful information about children and their role in transmission. I'll start with a study from South Korea, which is the largest study looking at over 65,000 people. And they looked at cases, mostly household cases, to try and determine who got infected from whom. And in that study, children under 10 years of age seem to be much less likely, or about half as likely, to transmit the infection as children between 10 to 19 years of age. So they do seem less likely to transmit, but it's important to note that it was not zero. They are able to transmit the virus. They just seem to do so much less readily than older children or adults. In terms of the risks of transmission from asymptomatic versus symptomatic individuals, I think generally from what we've seen thus far, the risk of transmission seems to be higher from people who have symptoms. They may shed a higher viral load, for example, and be therefore more contagious. But I think we still need to do more studies to fully understand the transmission ability of people with asymptomatic infection.
Okay, I think that clears up a lot of questions that people have had coming in. So hopefully very useful to them, especially in understanding how kids do play an important role in making sure that we are taking, safety precautions to help protect everyone, even those people that are at higher risk. So let's move on to a really big topic on a lot of parents and families' mind. It's fall and schools are going to be opening up soon, and there's been a lot of discussion in the United States as well as other countries about what we should be doing. And one of the places that I think that we should start with is, why were schools closed in the fall early on in the pandemic? And now there's discussion as we start to think about ways to return to in-person learning.
So the decision to close schools as really one of the first pandemic control measures back in the spring was really based on our understanding of other infectious diseases, especially influenza, and how influenza outbreaks propagate. With influenza, we know that school children are kind of one of the major propagators of that infection. And in situations of outbreaks in the past, school closures have been an effective way to bring that transmission under control. So that was kind of the initial reasoning for closing schools, along with many of the other lockdowns and other measures that were put in place early on. I think since then, we have learned some important things, as we've just discussed, about the true role that children play, understanding that many of these studies have taken place in areas where schools were closed. So they don't necessarily tell us what is going to happen when schools are open, or that these transmission dynamics apply to places with schools open. And so I think that's an important caveat to keep in mind. But as we have learned more about the ability of children to transmit, what their risk is of serious illness and death, I think that's where people are becoming more comfortable with the idea of sending them back to school. But the real question is, how do we do this safely? Because I think safety really is the number one priority here. And how can we learn from places that have gone through this before us in terms of effective measures to put in place as we make these decisions going forward?
Mm-hmm. And so what are some of the downsides that can occur of children being out of school for prolonged periods and doing that distance learning as opposed to the in-person learning options?
So schools are such a critical part of childhood development. They provide so many essential services within our communities to children and families. There are children who depend on schools for their meals. So we have seen increases in food insecurity, especially amongst vulnerable populations, minority communities, low-income communities. Schools provide social and emotional development for kids. Kids generally thrive on social contact and contact with peers, and learn so many important skills in that setting as well. And definitely that cannot be replicated through virtual learning systems. We also know that some kids depend on school systems for healthcare and for physical activity. And so those are all really important roles that our schools play. And that's not even mentioning the educational benefits of school, which obviously is one of the primary goals, and something that kids have missed out on from being taught virtually. I know a lot of teachers have really put forth a strong effort and really tried their best in the most difficult circumstances. Parents have really stepped up as well, but it's very challenging. And I think everyone kind of wants to try and get back to quality education for kids and have these discussions to figure out how we can best achieve that in the current setting that's going on with rising rates of community transmission in some areas, or still ongoing significant rates of infection in the community.
So speaking of those discussions, what are some of the factors that public health professionals and schools are looking at in order to make decisions about if or when they should reopen schools?
So I think the really critical part of this question, and really one of the first things that we need to look at, is the amount of transmission that's going on in local communities. When you look at different communities across the country, there's a very broad spectrum. There are places with extremely high rates of infection and transmission going on currently, and there are smaller counties or areas with low rates. And so the decisions made in those different areas will be very different. And it's really important that everyone look at what is going on in their local area and community as they try and make these decisions. We know that countries that have done this successfully, those are the countries that have reopened in-person schooling in the setting of low rates of community transmission. And so that is really, I can't overemphasize the importance of that as we make these decisions.
Yeah.
Secondly, I think you have to look at the school infrastructure that's in place in different areas. Schools were already kind of running at full capacity with not a lot of excess funding, if anything. And so I think we need to look at what infrastructure is in place, what infrastructure can be repurposed for different uses, and what funding is provided to schools to put the measures in place that they need to do. We do have specific recommendations, which we will get into a bit later on, about what schools can do to reduce the risks for their children and their staff. But these things take resources and some effort to put in place. And so we need to make sure that they're well supported for that.
We have a lot of questions from families about, should they send their kids to school and whatnot. What factors really should families be taking into account when they're trying to decide which education option is best for their child and their family's circumstances?
That's a great question, and something that so many families are struggling with. And these are difficult decisions. I won't minimize them at all, because they're complicated and they're difficult. And it's even difficult for us as healthcare providers to give people black and white answers, which I think is what everyone is really looking for there. But I would say there's kind of different concentric rings to think about here. So starting at the biggest ring, which is your community and what's going on in your community. As I mentioned, we want to limit reopenings to areas where there's low rates of community transmission of infection. It really doesn't make sense to open in an area where you have moderate or high transmission, or where you're having already increasing rates of transmission, even prior to reopening schools. So that's a factor that needs to look at very closely, and that public health and school officials will be factoring into their decisions locally. The next ring to think about is the school itself. So what measures have been put in place to protect students and to protect staff? So things like physical distancing of desks, having kids facing all in the same direction can decrease risks of transmission. Masking may be feasible for children in certain age groups and would be considered an effective measure, especially given what we know about asymptomatic transmission risk. Excellent hand hygiene, changing of schedules to allow staggering of schedules so you don't have crowding at pickup and drop off times. Things like that are all being considered, as well as cohorting of students. So having smaller groups of students or pods to limit the exposure of people to one another, such that if there is a case that occurs within a school, the number of people potentially exposed would be minimized to that smaller group. And so these are all strategies that have been suggested and can be implemented in various ways in various school settings and for different age groups of children. And so those are some of the things to think about when you're looking at what the plan is for your school. I think the most important thing is that there is a plan, that the plan is well thought out with input from experts, and that the plan is transparent and made available to parents so that they can understand kind of what is in place. The time to put the plan together is not when you detect your first case in a school. You want to already have that in place so that everyone knows exactly what's going to happen if and when, as will eventually be the case, someone tests positive in a school setting. The next concentric circle to think about is your family and your specific family circumstance. So we have a lot of multi-generational households. And so while the children themselves may not be high risk for developing a serious illness, they may be coming home to people who are. And so it's really important to take that into consideration as you make this decision for your family. And then finally, and most importantly in some ways, the child themselves and kind of what their own risks are of developing serious illness. Thankfully, as I mentioned, that risk is reasonably small for otherwise healthy kids, but it's not zero. And so I think that is really an important part of this equation as well. And so a lot of factors that I've listed there for people to weigh, measure, and consider. And so these are not easy decisions. And for anyone who has family members or children with underlying medical conditions, I think it is reasonable to reach out to your primary care provider for some guidance to help you make some of these decisions and understand the different risks involved with your specific circumstance.
Absolutely. I'm hearing from some of my patients and families, and I think that's completely appropriate. Reach out to the person who knows your specific medical history and your family circumstances, and as well as local and community transmission. So that's just excellent advice. You mentioned it's not a matter of if, but when that someone is going to be exposed, probably in one of the school settings. So we cannot completely eliminate all risk. And you discussed some of the risk reduction strategies. Is there anything else that schools are looking at as they return to in-person learning?
I think some of the other, there's a long list of strategies that have been suggested by groups like the CDC or American Academy of Pediatrics, which are all freely available online. I think some of the other things that people have recommended, we know transmission of infection outdoors, the risk is much lower than indoors. So in areas of the country where using outdoor spaces can be safely done, that is being encouraged as well. Obviously, in some areas that's not feasible in the wintertime here, we obviously wouldn't be doing education outside, but that is a reasonable strategy for people in other areas to use and could decrease risk. I think one of the big things is just the common understanding and commitment to stay home if you're sick is something that really this is all going to hinge on, and we really will depend on parents and families to do the right thing. And even if it may seem like a mild illness, a runny nose or a bit of sore throat, those kids really should not be sent to school because they are going to put others at risk, both for COVID-19 or other respiratory viruses. And so I think in supporting families in making that decision, that kind of feeds back into employers and how they are going to manage parents who might need to call in sick because they are going to do the right thing and keep their child home from school because they're ill. And how do we support families in making these decisions and not punish employees for staying home if they themselves are unwell or their child is unwell? I think these are kind of big societal things that we need to get behind and support in order for this to work. And I think it would be naive for us to think that there will not be any cases that pop up in a school. And so preparing for these situations in advance is really, really critical.
Absolutely. Another thing that you mentioned, like those other illnesses and stuff and staying home with them. I think this is a perfect time for us to talk about influenza vaccine and the upcoming season and why this is going to be critically important that people do get their influenza vaccines.
Right. So before I talk about influenza vaccine, I will just say we've seen a significant decrease in all routine childhood vaccines over the last few months. And so before anyone goes back to school in an in-person setting, I would encourage them to talk to their primary care provider to make sure all of those are up to date, because we don't want to run into a situation where we're having measles outbreaks or whooping cough outbreaks because kids have fallen behind on those vaccines. Specifically to talk about influenza. So the virus that causes influenza is obviously different than the virus that causes COVID-19, but the illness can be clinically indistinguishable, meaning you cannot look at someone and tell if they have influenza or if they have COVID-19. They cause very similar symptoms, including fever, cough, shortness of breath. And so getting your flu shot and doing everything you can do to prevent getting the flu, which includes many of the things we're recommending for COVID-19, like hand washing, is critically important this year, more so than any other year even, although it has always been important. We do know that children have a higher risk, especially young children under 5 years of age, of severe illness with influenza. And so we're definitely pushing everyone over 6 months of age to make sure they and their family get the flu shot this year. It could decrease the number of febrile illnesses that result in children getting sent home. And it could decrease the number of outbreaks of flu, obviously, as well in this setting as we navigate this kind of unique circumstance this year.
I just want to put in a plug. We did a Facebook Live show a couple weeks ago with Dr. Jacobson, and we talked extensively about immunizations, keeping your child up to date with their routine immunizations and health maintenance visits. So if people are looking for more guidance about this more extensive discussion, please go to the Facebook page and you can find it archived there. But kind of coming back to our discussion now, another concern that we are discussing and is coming up is how do we protect the staff and teachers in the school setting, and what can they do to help stay safe?
So this is a really important question. And if you look at all the people that are present within a school, teachers and staff or the adults are really the highest risk of developing more serious illness if they do get infected with SARS coronavirus 2. And so I think their buy-in and involvement with this decision making is really a critical part of all of this. And I think they need to receive the education and training in order to keep themselves safe in school settings as well. I think some of the recommendations have revolved around the same concepts as cohorting or having limited interaction between the number of students and a single teacher, having teachers rotate from classroom to classroom instead of having students rotate from classroom to classroom to reduce congestion and things like that. Obviously, excellent hand hygiene, frequent disinfection of high-touch surfaces, and then masking as a really important part for teachers, especially as adults, plus or minus, depending on what is happening with the students in their classroom, the use of eye protection if they're going to be in close contact with especially maybe young children who aren't able to wear a mask consistently. Those are some of the really important things. I think having spaces for teachers when it comes to meal times. So I think meal times are kind of a high risk situation, both for children and adults, because you obviously cannot wear your mask when you're eating a meal. And so in scenarios like that, physical distancing becomes even more critical. So ensuring that staff at schools have space during meal times such that they're not in close proximity to other adults who may be at a higher risk of transmission in order to eat their meals will be very important as well.
That's an excellent
and I think
point.
offering alternatives for teachers who are especially high risk to have alternatives to potentially participating in in-person instruction will be important as well.
Absolutely. All right. So, how do we counsel parents about how to prepare their child for the return to in-person learning, where there's going to be different safety measures and things like masking and the other social distancing safety recommendations that you've discussed?
So I think it's important to start the discussions early with your child, as early as possible, as soon as you make the decision or know what is going to be happening with their schooling in the fall. Especially when it comes to younger children who may need a bit more time to get accustomed to some of the things they're going to be asked to do in a school setting. So for example, when it comes to masking, I think it's important to kind of start that early. With young kids, some of the things that can work well is just having them involved with choosing the mask itself. If they have a mask in their favorite color or with their favorite character on it, they may be more inclined to wear it than if they don't like the mask or if the mask doesn't fit comfortably. So it's really important to get the masks in advance, try them on, make sure they're comfortable for your child and that they like them. Wearing them around the house for short periods of time to begin with can help them get used to it. We've all had to wear masks here and in the public, and we know that it does take some getting used to, but I've been very pleasantly surprised by the children that I've seen in our clinic here who really have done a fantastic job. And I think it's a matter of getting used to it, acknowledging that it's something new and giving them some positive reinforcement for doing a good job of it when they are. For young kids, practicing playing with the mask, putting the mask on their toys can help to normalize the experience a bit for them as well. Older kids may not need as much lead up time, but they should be instructed clearly on some of the safety related things related to masks. So not touching the front of the mask once it's on, how to safely put on and take off the mask. So touching only the ear loop portion of the mask and avoiding touching the surface of the mask itself. These are all things that kids and families can practice in the safety of their own home before they end up in a school setting and having to learn it for the first time. And I think a really important part is just really good role modeling by parents. If you are role modeling good mask wearing, kids tend to pick up on that and follow along as well. The other thing I think is really important is a refresher on hand washing and talking through that with kids, both how to do it properly with soap and water for 20 seconds and how to use alcohol-based hand rub properly as well. And then ensuring that they have a readily available supply of those at school will be important also. But I think starting to talk to kids about how school might look different, how things might be different this year, and starting those discussions early will go a long way in helping them to adjust to these circumstances.
We touched a lot on our last Facebook Live about some of the misconceptions about mask wearing. And I just want to touch briefly on those and then direct people to also take a look at that video because we try and answer a lot of the misconceptions. One that comes up frequently is that children, it's not safe for them to wear masks, or that it decreases their carbon or their oxygen and increases the carbon dioxide. Is any truth to that?
So masks are safe. I would say that people who are excluded from mask wearing, so children under 2 years of age, and that is because they generally may not be able to remove the mask themselves if they're needed. So young children or anyone who would not be able to remove the mask themselves. So if they have a neurologic issue or a developmental disability or things like that, that would be a reason not to place a mask on someone. But otherwise, there's no safety issue related to oxygen or carbon dioxide clearance in healthcare settings. We all wear masks for prolonged periods of time. We have surgeons who operate and do very fine motor procedures with masks on for prolonged periods, and they have never been shown to decrease your oxygen levels or increase carbon dioxide.
Absolutely. We have some audience questions as we getting close to the end of our time today, and I just want to run through them. Have we learned anything over the course of the summer and the late spring about daycare and how they've been able to reduce the risk of transmission, and any successes that we can take from that as we implement them into the return to school in-person learning?
So I think there are some strategies that have been effective in daycares, but I think there are some unique aspects to that group of children or that age of children as well. So as we've already talked about, young children under 10 years of age seem to be less likely to transmit infection than older children and adults. And so I think various strategies have been used in different places, some with success, and then some areas there have been cases or small outbreaks within daycare settings. And so I think that age group is unique in that obviously their ability to physically distance is very limited, and to provide care for them, you need to be in close physical proximity. And I think from those situations, one of the things that has come out is just the importance of appropriate protective equipment for the people working in that situation. And so usually a mask in addition to eye protection has been recommended.
Okay, fantastic. What about a little bit more defining of children? You know, we've talked about which children are kind of a little bit more higher risk based on age, but are there any specific conditions that we think about for children that make them at higher risk for more serious COVID infection and symptoms?
So this has been a very interesting part of this pandemic. So some of the groups that we traditionally worry about with infectious diseases, obviously immunocompromised patients. So children who have a weakened immune system, whether it's because of a condition they were born with, or they're taking a medication that weakens their immune system, or they have a transplant, for example. I would say just this past week, the transplant societies and infectious disease society for kids have put out guidance for families of children who have a transplant, solid organ transplant, and recommendations. And what we have seen is really even those children, they seem to be behaving more like other children when they get infected, rather than being at extremely high risk for severe illness. So not to say that they shouldn't be taking all the usual precautions that we're advising for everyone, but there have been cases now of children with transplants who have had asymptomatic or very mild illness, and that seems to be the majority of them. I think it's important to recognize that immunocompromise is not kind of one group. There's a lot of diversity within that group, ranging from mild immunocompromised to severe. And so that's why it's really important, if you have a child who is immunocompromised, to speak with your healthcare provider, who can help you understand kind of where your child might be on that spectrum. For example, a child who's had a transplant in the last 3 to 6 months, their level of immunosuppression will be higher than a child who had a transplant a few years ago and has not been treated for rejection, for example, recently. And so the decisions for those children will be different than a child who's recently had a transplant. So I think there's a lot of kind of nuance within that group, and that's why it is so important to speak to your physician who understands kind of your situation and your child's situation the best.
Mhm. And this may be something more for a pulmonologist, but maybe something you can help answer. But asthma is a common childhood disease or illness, obviously affecting the lungs. Are those children considered to be at higher risk as well, or not necessarily?
So for many children with asthma, viral infections can be a trigger for asthma attack. I think
Mhm.
children with asthma, the most important thing is to make sure that the asthma is under good control, and then to follow the usual precautions that we've recommended for everyone to avoid infection. I think there's been obviously some kids with asthma who have had to be admitted to hospital, but many have not. And
Mhm.
so I think just following the usual precautions and ensuring working with your doctor to make sure that any
Mhm.
underlying conditions are well controlled is really the important message there.
Yeah. And making sure that you are taking the medications as prescribed and trying to remember them, especially those daily maintenance medications for asthma, can be really important at decreasing those underlying inflammation in their lungs and setting them up for probably having less severe illness if they do get sick with just even common respiratory illnesses and stuff. We are almost at the end of our time. Let's talk for the last minute about vaccine development. What are things that are currently being developed, and what do we know about them so far?
Yeah, so this week we have seen some of the large phase 3 vaccine trials begin. Um, Most enrolling about 30,000 patients in each trial. These are going to be tested in adults first. So usually children or other special populations like pregnant women are not within the initial cohort that we test vaccines. There has been some promising studies. I think there's 3 in the United States that going into phase 3 trials that have shown the vaccines to be safe in smaller numbers of people and effective in terms of generating an immune response. And so there are some promising candidates. I think worldwide there's some 200 vaccines under development, and so people are still actively working on this. But optimistic reports are that we might have some of the results from these large phase 3 trials by the end of this year, and should have a better sense of then how quickly we can get a vaccine into production and which one is performing the best out of all of them.
So stay tuned, is what you're saying. More to come.
Yeah,
Okay.
a lot of work being done right
Yeah.
now, but no definitive results yet for the large trials.
Absolutely. Well, this has been so helpful. Do you have any final thoughts that you wanted to end up in sharing with people?
I just want to say that these are really challenging circumstances and times that we're all trying to navigate together. I think it's really going to be important for everyone to try and be flexible, to try and have backup plans in place. I think if schools open, there's a chance
Mhm.
that they might end up having to close, and so both families and schools need to be have a plan in place for those circumstances. And I think we need to be kind and be flexible. The decision for one family might be different than the decision for another family, and we need to recognize and acknowledge that and help support people in making the decision that's best for themselves and their families.
Absolutely. Thank you for joining us today. It was wonderful to have you back again and sharing your knowledge as always. Thank you, everyone who watched, and thank you, everyone who sent in questions. If we didn't have a chance to address them specifically, we will try to address some of them after the live broadcast. Thank you, everyone. Stay safe, wear a mask, wash your hands, and maintain your social distance. Have a great day.
Thanks.
Thanks.